Nearly 70% of Republicans and Democrats agree that Medicare and Medicaid should cover GLP-1 medications. But new policies could take the coverage off the table for millions. Stay with me because the fight for access isn't just political, it's about your health, your future, and keeping the medication that works for you. Welcome to the Downsized. I'm Christopher Durham. If you're new to our channel, let me tell you about what we're all about. My wife Laraine and I have been on an incredible adventure to fight the disease of obesity with GLP-1 medications, and together we've lost 150 pounds using Zepbound, Mounjaro, and compounded tirzepatide. I've personally lost 98 pounds, and it has been life-changing, not just for our weight, but for our overall health, our energy, and our mindset. Here at The Downsized, we talk about all things GLP-1s and weight loss, the latest news, personal experiences, and what it's really like to use these medications. We cover everything from side effects to affordability and access issues. We also share real stories from real people because this isn't just about weight loss. It's about taking control of your health. But before we go any further, let me be clear, we're not doctors. We're here to share our experience and the latest updates, but always consult a healthcare professional before making any medical decisions. And if you find our content helpful, hit that like button, subscribe, and turn on notifications so that you never miss an update. I've said it before, we are not a political channel. We are wholly focused on GLP-1s and treating the disease of obesity. But we do cover political stories when they directly cross paths with GLP-1s. And today's story does just that. Now, let's talk about something rare in today's political climate, something that both Republicans and Democrats actually agree on. A new national poll from the Diabetes Patient Advocacy Coalition, or DPAC, shows overwhelming bipartisan support for Medicare and Medicaid coverage of GLP-1 medications. Nearly 70% of Republicans, and specifically Trump voters, support expanding access to these life-changing treatments. That's a direct contrast to the stance of newly appointed Health and Human Services Secretary Robert F. Kennedy Jr., who has proposed cutting Medicare and Medicaid coverage for these medications. George Huntley, CEO of the Diabetes Patient Advocacy Coalition, put it bluntly. Limiting access to these therapies isn't just poor policy, it directly contradicts what Republican voters and the American public want. The numbers speak for themselves. 73% of respondents agree that covering GLP-1 medications could make the U.S. more productive and globally competitive. 72% of people believe Medicare and Medicaid coverage should match the federal employee health benefits program, especially among those who were initially skeptical. 68% believe that Medicare should cover these medications to prevent patients from losing access when they turn 65. If you're using GLP-1s to treat the disease of obesity, this fight for access is about more than just politics. It's about your health, your future, and your ability to stay on a medication that works. Many of us have struggled for years, maybe even decades, to lose weight. We've tried diet after diet, exercise plans, and everything else the world told us to do. But for so many, GLP-1 medications finally gave us the tool we needed to lose weight and regain our health. And yet access is still a huge barrier. The high costs of GLP-1s make them out of reach for many. Insurance companies refuse to cover them for obesity even though we know they work. And if you're on Medicare, you could lose access to a medication that has transformed your health just because you turn 65. This isn't just about weight loss. It's about preventing heart disease, diabetes, and other chronic conditions. It's about giving people a real chance to improve their health and extend their lives. That's why this conversation matters and why the overwhelming public support for expanded coverage is so important. If the majority of Americans, Republicans and Democrats alike, can agree on this issue, then policymakers need to listen. The reality is over half the adults in the United States, 137 million people, qualify for GLP-1 medications under FDA guidelines. These drugs are already approved for obesity, of course, which is a BMI of 30 or higher, or a BMI of 27 plus with at least one weight loss related condition like type 2 diabetes or hypertension. Yet despite growing awareness, 85% of poll respondents are familiar with GLP-1s. Yet despite growing awareness, 85% of poll respondents are familiar with GLP-1s. Access remains a major hurdle due to high costs and restrictive coverage policies. Dr. John Anderson, a board member of the Diabetes Leadership Council, put it simply: we need to reduce barriers and make these life-changing obesity medications available to at-risk Medicare and Medicaid populations. This poll is a wake-up call for policymakers. The science is clear, the public support is overwhelming, and the need is undeniable. If coverage expands, it could change the lives of millions struggling with obesity and weight-related conditions. This is where we all need to step up. If you're using a GLP-1, or you know someone who's using a GLP-1, or you'd like to use a GLP-1 and you're working with a doctor, now is the time to make your voice heard. Call, email, or write to your elected officials and tell them obesity is a disease and it deserves to be treated like one. GLP-1s should be accessible and affordable for everyone who needs them. Medicare and Medicaid must cover these medications to ensure that patients don't lose access based on outdated policies. I'll leave the link in the description where you can go and find your representative's contact information. Let them know that we need action now. If nearly 70% of Republican voters and a majority of Americans agree that GLP-1 medications should be covered, why are policymakers still dragging their feet? This is why advocacy matters. This is why we need to speak up, share our stories, and demand better access. Because no one should be denied medication that could save their life. At the Downsized, we believe in sharing real stories, real experiences, and real results. So join us every Wednesday for the Downsized Live, where Laraine and I talk to you, celebrate your wins, and answer questions. Every week, we also bring you the Downsized news, breaking down the latest updates in the world of GLP-1s, what's happening with drug companies, insurance coverage, research, and the science behind these medications. We also, of course, host our weekly Downsized Dish interview series where we bring you real stories from real people who are using GLP-1s to take back their health. If you want to stay informed, inspired, and connected, make sure you subscribe and join us on this adventure. That's it for today's video. What do you think? Should Medicare and Medicaid cover GLP-1s for obesity? Drop a comment below. I'd love to hear your thoughts. And don't forget to hit that like button, subscribe, and turn on notifications so you never miss an update. I'm Christopher Durham, and we are the Downsized. I'll see you next time.